Morning, today is April 7th, 2026. This Tuesday, and present with us right now is County Health Nurse Supervisor Pam Hanna and our emergency, is that the emergency management?
Emergency manager, that's fine, yeah.
Okay. Good dog. So Pam, do you want to start us off with that, please?
Thank you. Good morning. We are grateful to say that a lot of our respiratory illness has slowed down. So I think we're kind of over that peak, which is good. We've still had some other communicable disease investigations that we've been working on. And one of them is a complicated communicable disease. So the patient is currently in isolation and needed us to help with housing and food and accommodations for this patient. So Montana DPHHS actually will fund the housing portion of this, and then on a local level, we will provide the food. We expect the patient to need to be in isolation for a month. It could be longer depending on how the disease process goes. But that's what we're kind of, our target for now is about 28 days. So there are also close contacts to this person that we've been working with. So I deputized Jesse to do logistics for this. So he's kind of helping with the food and that kind of stuff, because a lot of what we as nurses are doing has to do with the management of the illness and the patient and the close contacts. So there's been a lot of testing, a lot of medication. We have to observe the patient taking the medication daily. So we've set up a system so that they take a recording on their phone and send it to us through a program we have called JotForm, which is HIPAA compliant. So but we are still putting eyes on the patient a couple times a week. Yesterday, I did transport for the patient to go get testing done at the lab in Helena. So it took about a half a day. Tana was out of the office. So it is it's like a small number of patients, but it's taking a lot of time for three of us. So just that's an update there. And then I guess to let you know, I will be gone next week out of the office because I'll be in Billings for a conference Tuesday, Wednesday, Thursday. And I'll probably have enough hours that I won't have time for Friday. So Aaron will be covering the clinic on Friday for us instead of me. And then next week also, we're doing the health fair at Jefferson High. So this fulfills a couple of our grant deliverables. It fulfills our prevention activity for our FICMR prevention activity, which is part of our maternal child block grant. So we have a lot of partners coming in to help with that. We did it last year. It was very successful. So we decided to do it again. In fact, it was requested that we do it again. So that'll be happening on the 15th. And then on the 22nd, the following week, we will be in Whitehall. And their request this year, we just did high school in Boulder. And last year we did 6th through 12th in Whitehall, because that's kind of how their school is divided. They're divided pre-K to 5, and then they're divided 6 through 12. But their request for us this year was to do all of their grade levels. So we're going to do a fair for their whole school. And it's honestly, the population for their entire school is similar to the population for the high school here. So that'll be kind of a new adventure. Because it's a FICMR prevention activity, we've kind of targeted what we've had loss of children the last few years, which suicides, so suicide prevention, mental health, and then seatbelt safety, because we've lost kiddos in car accidents. So that's kind of where our focus has been. So Aaron has worked really hard to get partners in those realms to work with us in those. So I'm excited about that. It was fun last year. It's really actually fun to be in the community and participating that way. And then I guess my nurses and I also, and Molly will also be at a conference April 23rd. It's an annual one that the immunization program at the state does, and we always go to that. So that'll be April 23rd. I'll be out of the office, but Jess will keep the office open and running. Molly is doing environmental health project with them tomorrow. They're doing an installers class out at the volunteer hall. So they'll be there all day doing that. And Molly's been on vacation the last 2 days, so she'll be out of the office again tomorrow. So that kind of brings me around to our status on the sanitarian position. I had heard that there was a candidate that was maybe being looked at for that sanitarian position. So just wondering if there are any updates on any of that, how we're doing with trying to hire.
Sanitarian.
Mhm.
We are working on it.
You have one.
No,
Okay.
we do have one, but there's some other things involved. So I think
Okay.
we're gonna, where we're at this point is I think we're gonna RFP the contract.
Okay. Well, you'll just kind of keep me in the loop. It kind of affects my workflow with what we're doing with environmental health.
It looks
But-
like we're on track to have an in-house sanitarian at some point.
Good.
So,
We want one.
yeah.
Yeah.
Not all that far in the future, but not soon enough to where we're not gonna have to use the contractors for.
Everything.
Well, I mean, what we're doing right now is working. It is extra work on our plate, but so far it seems like we're managing it well. And it really is my hope that even after we hire a sanitarian, that we're still really, melding environmental health and the department. That really works well. And, we've always kind of on the nurse end done a lot of the things as far as, animal bites and foodborne illnesses. Some sanitarians take that, but it's always been on our nurse plate here in this county, so. And then I also was kind of wondering if there were any updates for me on building expansion.
I'm just waiting for you to give me a drawing. This is what I want.
We gotta get the building.
The Taj
permit.
Mahal.
Okay, I'm gonna do that.
That
All
I
we
right.
would
talked
start
about.
thinking about that.
I told you to put on there what you want,
Yeah,
everything.
I haven't had a lot of time to focus on it right now, so I'm kind of wondering if there's like a time frame in that, because I did hear you, Craig, to get my wish list put together.
My thoughts for this building that Pam and I talked about last week before last. maybe,
It was
because
a
I
couple weeks
going-
ago, yeah.
Was I told her to think for the future, and we may or may not be able to do it all, but to think towards a mental health office, to think towards a possible dental area, to think towards a physical therapy area, to have a plan to have the sanitarian in that building.
Yeah,
And
And I
if
guess,
this
you
this
know-
is the time to do it.
right. And how does that kind of work with our medical side? Are we gonna have a conversation with them about what they need? And, cause I don't wanna take space from them that they need, but if we're expanding, it could be that we're looking at the whole building,
Right.
not just our half.
No, when we start talking about expansion, they'll definitely be at the table, because
Okay.
maybe
Alright.
they need more, maybe they don't, who knows, but we
Well, I
wanna have that
know,
conversation.
on their side, the treatment room that they're using it's where the ambulance bay is.
Right.
I don't know that they need all of that space. So that would be something to negotiate is, can we build a conference room on the front of that side? Maybe take a portion of their space, make their treatment room a little smaller, so that we can use what I had originally thought would be conference room on the other side for the sanitary and for a mental health office, for things like that. Because
Start
we are,
sketching it out.
we are still limited on space, you know.
Get that diagram I gave you. and
Do
just
us, do us a
pencil it out.
drawing,
All right.
architectural, please, all of the measurements.
You know that I designed
What kind
my
of words
house,
you'd like
and
to
you know
use?
I designed my house in pencil. I did, and I drew it out on, you
A
know,
napkin.
no, I had graph paper. I took
Okay, well, you
drafting
did it
in
all
high
the way.
school. I know what to do.
Well,
And then
don't say
I-
too much, we're gonna expect that.
And then I
on
sent
this
it to an
project.
architect to make sure that it worked, but I cut my furniture out into little pieces that were.
Nice.
Be
Yeah.
careful what you wish for.
I've had a little bit of experience there, a little bit. So I think that's really what I have to report to you and the questions that I had. So I don't know if you have,
You're gonna have a whole office over here.
I
people.
know, I'm kind of thinking, wow, I got a whole bunch of support today. And then I'm wondering, what did I do? So,
You're gonna be gone next week, and the health fair is gonna happen next week, you won't be. at
the
health
the
fair?
one in Jefferson County
Right, okay,
is gonna happen next week, and I'm gonna be gone.
okay,
So Aaron's kind of our incident command on this one. Like I said, we have been practicing ICS structure when we've been doing events, just so we're getting some, you know,
Mhm.
real live experience with it, but anyway.
I was just curious, I was just making sure I heard you right.
Yeah, and I am available. I'll have my phone and my computer and I'll be checking my emails. I'll just not be physically here for a week, so. Anyway. And I'll get my drawing out and get my colored pencils and,
I hate to get too much work into this, just in case something falls apart in between now and when we actually get the building, or if we decide to get the building, so. I haven't pushed it too hard on that.
right. And I guess there is one more thing, Craig, Commissioner Doolittle sent me, some information on the homemaker and respite program
This
that,
is through the area 4 board on Aging.
yeah. So we've had a couple of conversations about that. I think, didn't you tell me the application deadline is in this month, April,
End of April.
end of
We gotta,
April?
she will extend it through the end of April.
And so I've reached out to a few people that are doing it. It is something I see as that would fill a gap that we have here with our aging population. And I'm having people contact me, you know, regularly needing help and care in their home. But the people that I've talked to have said it's somewhat time intensive as far as what we're doing. So I'm looking at how we manage things. With the NTI grant and the Pathways grant, which are supplemental to what I usually do, there's a lot on my plate. I have to admit, the Pathways grant has been a challenge. And I'm gonna talk with that facilitator this week because I really feel like our best interests would be put into something like the homemaker rather than these policies and procedures that I'm sitting behind a computer doing. So I don't know how you guys would feel about the possibility of relinquishing the Pathways contract. It's not necessarily money we're depending on for anything but that project. I'm a little torn because I don't know how that's gonna impact future grant funding through that system, which is the System Improvement Office. But it is something I would like to discuss with that facilitator because in all reality, if I'm gonna take something else on, something's gonna have to move. So I don't know what your thoughts are on that.
And I think what you and I talked about is that's probably important, but I think something where we're helping the people could be more beneficial, might depend on how it affects everything else. But I think helping the people that are doing that home care and things like that is, from what I know about both sides of it that you've told me, maybe more important, and maybe not more important, but more important to the people that we're dealing with.
The outcomes and impacts we have on our community.
Yeah.
I don't disagree. I just don't usually start something I don't finish. So that's, a little bit. I'm just weighing, and I also, don't wanna commit or not to commit to something unless I, got your support in that, so. I'll let you know how that conversation goes with her. It's Carrie Pride, if any of you guys know Carrie.
Mm.
She's from Twin. You know Carrie, you met her when we went up to the conference. She's a love. All right, well, that's all I have.
You don't want me to interrupt that. I just came because I had it on my schedule to come because after Jesse's exercise, if there was some topics that you
Yeah,
wanted to talk about.
and
I mean,
I-
I know we came
Yeah,
before.
I did have it kind of on my follow-up list.
I just
figured
wasn't sure
that
if- I
Was
mean,
probably why you were here.
I wasn't sure if you needed, I mean, I'm happy to answer. I mean, it's kind of the same stuff that we went over as far as if you need help during an incident, and paying for that is the biggest question, right?
Well, what we've calculated for thinking about my current communicable disease patient.
Sure.
So what we've calculated for that is it will probably be in the ballpark of around $1,000 for what we as the county are responsible for. I do have that money in my budget. I usually have a little slush in professional services just because you don't know what's gonna happen.
Right.
I have some money also designated for labs, and I can move some of that around. So I don't see that we're gonna have a problem paying for that out of my budget. I just think I just need to look at where I've got some reports from Ginger that I've got to look at. So I'm not seeing that that's gonna be a problem, that this isn't gonna be a big enough thing for that. So I think we're gonna be okay. Now, if any of those close contacts end up needing care, because with this disease, care is long-term, it's not, a week, it's months
Yeah.
of treatment, so then it might change, but so far, we've been okay with the close contacts, so there's follow-up testing that we're gonna have to do in the next few weeks. That'll determine where we go with the close contacts. So,
And I guess I mean, from my perspective, and this is your world, but knowing where to have that trigger point of expense for what your budget can handle, and then what the county budget can handle, and then when you would need to draw that line for an emergency declaration.
Yeah.
And go through that whole process like we talked about when I was in here. I mean, I know that line's fuzzy and it's hard to say specifically, but it's just something that there's those
well,
three
we should know
stages.
better in
keep
about a
in mind.
month when we do the secondary testing on the close contacts. I think for our current patient, I think we're gonna be okay. I've gotten all the documentation I need from the state to be able to submit for the housing. I don't know how long it takes them to pay for the housing, but I am working with them to get that paid for, so that should be done. Last week, like I said, Jesse's, doing logistics for the food on our patient, and last week it was only $60 in food. So that was way under what we had calculated to budget for the week. So when I transported yesterday, I had conversations with the patient about, their needs and what, making sure that small amount was enough to, care for what they needed. And I think this person is modest and simple in their needs, and is, has honestly been compliant and easy to care for, so
Oh, I apologize. I was more talking, not in this specific case, but just in general, kind of the stuff that we talked about before, as far as when those decisions need to be made for any case. I mean, this one doesn't sound very likely. But just with regard to expenses, where your budget wouldn't be able to handle, and then whether the county would have some sort of funding with outside of the emergency declaration. and mill levy
Yeah, I
process.
really think, Doug, it's just gonna be a case by case thing where we have to look at it and, you know, in a way, this is gonna probably be to our advantage because of the timing, because we may be able to put this over 2 fiscal years, you know, depending on how this works. If, you know, we end up having to treat close contacts later, it may end up running into next year's budget, so.
I know what you're asking, Doug, as far as like having something kind of solidified as far as like, maybe like you hit like an overtime threshold or something like that.
Yeah, I mean, I mean, it's gonna be situational. I agree with that. I just I wanted to be here because we had talked about this and I don't have any specific guidelines. I just, if you had some idea on that, I wanted to be able to be here to
Yeah.
provide input, but.
Well, I guess medical emergencies are a little different than other emergencies
Right.
because they're so, you know, dependent on the disease process and the human and their compliance. So like I said, I think in this situation, we've got a best case scenario
Right.
is what I'm thinking. So, I guess.
No,
we'll
I didn't
see.
mean to belabor it. I just was trying to provide help.
Yeah, so.
That's a good thing to think about for future.
I learned
incidents.
something this morning, it's really illness dependent, like some illnesses you only isolate for a week and then it's done, but like something like, you know, what we're experiencing now could be a kind of a longer term deal, so it is kind of situation dependent.
Yeah, and it's just situational awareness for the commissioners, so they know that that could be something that you have to face at some point, depending on what the situation.
Well, and I truly am not very experienced in all of that, so, you know, having everybody's help and guidance is something I will need. But, right now I'm feeling like, you know, I'm not nervous about our situation. I feel like we're okay. So,
And Ginger's really good about doing this
Yeah.
stuff too. so.
yeah, Jesse ended up doing some of that meeting work because I was on vacation when all of that happened, so, but I think we're in a good spot.
Get your pencil and crayons out for your design. What's your next project?
All right, I got colored pencils. I'm ready to go. All right. Well, thank you very much. I appreciate your help.
You, man.
And I'll
Thanks for what you do.
see you soon.